All right, welcome back. Today we're going to dive into something that's a truly life-saving medical procedure, but honestly, it's one that's often really misunderstood. We're talking about surgical stomas.
So let's just get right to it. What is a surgical stoma? It's a term that might bring up a lot of different images, but when you get down to it, it's a pretty fascinating piece of surgical engineering. So let's start with the basics.
Okay, so here's our game plan. We'll kick things off with the absolute fundamentals. Then we'll compare the two main types you're likely to hear about. After that, we'll look at some of the potential complications, and we'll wrap up by really zeroing in on one specific challenge, the peristomal hernia.
All right, let's jump right in. First things first, what actually is a stoma?
Okay, let's break this down. In the simplest terms, a stoma is an opening that a surgeon creates. It connects an internal organ, and we're usually talking about the bowel here, directly to the surface of your abdomen. A good way to think about it? It's like a purpose-built new exit ramp on the body's digestive highway.
So you might be asking, why would someone need this? Well, the number one reason is often to protect a really delicate surgical joint while it's healing. See, when surgeons take out a piece of the bowel, they have to reconnect the two ends. And that connection point, it has a technical name, an anastomosis. A stoma basically diverts waste away from that spot, giving it that crucial, undisturbed time it needs to heal up properly.
Now, stomas generally fall into two main camps. First, you've got your temporary stoma. This is, a short-term solution. It's there to let that internal joint heal, and the cool thing is it can be surgically reversed later on. On the other hand, you have a permanent stoma. This is more of a long-term fix, and it's usually needed when a significant part of the bowel, like the rectum, has to be removed completely.
Okay, so that builds nicely into our next section. We're going to look at the two most common types of stomas you'll hear about, the colostomy and the ileostomy.
First up, we have the colostomy. And just like the name suggests, this one involves the large bowel, also known as the colon. It's typically placed on the left side of the abdomen, and you'll often see it after a procedure called an abdominoperineal resection.
Now, the next one, the ileostomy, this one has a really interesting design feature. This involves the small bowel, specifically the ileum. Now, because the waste coming from the small bowel is pretty acidic and can be really irritating to the skin, surgeons will often create the stoma with a little spout that sticks out slightly. It's a super clever design, really. It directs everything away from the skin and right into the collection bag, which helps prevent a whole lot of problems.
So let's put these two side by side to really see the difference. It pretty much boils down to location and which part of the bowel we're talking about. A colostomy, that's the large bowel, usually on the left side. An ileostomy, that's the small bowel, and it's typically on the right. And of course, this affects how they're built, with that ileostomy often having that protective spout we just talked about, while the colostomy is usually flush with the skin.
Okay, so we've got a good handle on what they are and the key differences. But look, like any major surgery, creating a stoma isn't without its risks. So let's turn our attention to some of the potential challenges that can pop up.
This is a big change to the body's anatomy, so it makes sense that a number of complications can happen. The list here covers a lot of ground, from things like swelling or edema and bleeding, all the way to more complex issues like a prolapse, where the stoma itself actually extends out from the abdomen. These are the kinds of hurdles that both patients and their medical teams have to be ready to manage.
And with an ileostomy in particular, there's one number that doctors and nurses are always watching very closely: 1 liter. If the stoma's output in a single day goes over 1 liter, it's officially considered high output. And this is a really big deal because it can lead to dehydration and throw the body's electrolytes way out of balance super quickly. So that careful monitoring is absolutely essential.
And that brings us perfectly to our final section. We're going to zoom right in on one of the more significant long-term complications, something called a peristomal hernia.
So what exactly is it? Well, a peristomal hernia is what happens when some of the abdominal contents, we're usually talking about a loop of the bowel, pushes its way through that weakened muscle wall right next to the stoma. This creates a really noticeable bulge right there under the skin.
And this isn't just a bulge, it can become a real medical emergency. Listen to this quote from a clinical source. It's pretty stark. An acutely incarcerated peristomal hernia presenting with complete bowel obstruction. Let's unpack that. Incarcerated means the bowel is literally trapped, and its blood supply can get cut off. And when that happens, it can cause a total blockage, which, as you can imagine, needs emergency surgery right away.
All right, let's do a quick recap of the key takeaways here. Stomas are surgical openings designed to reroute waste. They can be temporary, just to let things heal up, or they can be permanent.
The two main players are colostomies, which involve the large bowel, and ileostomies from the small bowel, and they have some really important differences. And finally, and this is crucial, while they are absolutely life-saving, they do carry a risk of complications like hernias that need careful, ongoing management.
And all of this really leads us to a bigger, more thought-provoking question, doesn't it? As our surgical techniques get more and more advanced, saving more lives than ever, how do we strike that balance? The balance between these incredible life-saving interventions and the new long-term challenges they can create for the human body. It's this constant dance between innovation and adaptation. Definitely something to think about. Thanks so much for joining me.